Imagine this. You walk out to your pasture, and your horse, usually so vibrant, so athletic, it's just well off. Maybe they're making a weird noise when they breathe, or struggling a bit to swallow, maybe stumbling, for no clear reason.
Yeah, subtle things.
Right, subtle at first, almost invisible. But it's growing, and you just can't figure out why. This isn't just an off day. It could be something insidious, a silent threat hiding in plain sight.
It really can be.
So today, we're diving deep into something crucial for every horse owner. Equine lead poisoning. You might hear it called lead toxicosis or plumbism.
Right.
Our mission here is to really uncover what this is, where lead might be lurking around your place, how it actually impacts horses, biologically, and then how it's diagnosed, which can be tricky, the treatments available, and crucially, how you can prevent it. Understanding this silent threat, it's really your best defense. So let's get into it.
Okay. And it's important to know right off the bat that while lead poisoning might seem less common in horses compared to, say, cattle or dogs, horses are definitely susceptible.
Go.
It's a really serious condition. It comes from ingesting or sometimes inhaling too much lead. And because the exposure is often chronic, like low level over time.
Right, not like one big dose necessarily.
Exactly. Pinpointing the problem can be, well, incredibly challenging for owners and vets.
So it's sneaky. When a horse does get exposed to lead, what's actually happening inside? Does it target one thing, or is it more widespread?
That's a key point. Lead is what we call a multisystemic toxin. So no, it doesn't just pick one target. It impacts multiple organ systems. But in horses, the ones we see hit most often are the neurological system, the brain and nerves, the gastrointestinal system, and the hematopoietic system.
Hematopoietic. That's blood-related.
Yeah, exactly. The blood-forming tissues.
Got it.
Yeah.
And where's this lead usually hiding? What are the big environmental culprits that, you really need to watch out for?
Well, probably one of the most common sources, maybe surprisingly, is old lead-based paint.
Really? Paint?
Yeah. If you've got structures built before, say, 1978, an old barn, fences, sheds, anything like that.
Okay.
Lead paint was super common back then. And as that paint gets old, deteriorates, peels, horses can chew on it or lick it. They're curious, right? And they ingest those lead chips directly. It's a huge risk.
Wow. It's kind of scary to think those charming old barns could be dangerous. Okay, so beyond the barn itself, where else? What about out in the pasture?
Contaminated pastures and soil are another major source. This often happens in areas that were near old industrial sites.
Like factories.
Yeah, I think old lead mines, smelters, maybe battery factories. Lead could have gotten into the soil years ago, and it just stays there.
Stays there for a long time.
A very long time. And also, you got to check old dump sites or junk piles on the property.
Oh, yeah.
Definitely. People used to dump stuff everywhere, right? So you might find old lead-acid car batteries, bits of old machinery, construction debris, maybe even things like old linoleum or solder that contained lead.
Huh. Things you wouldn't even think twice about normally.
Exactly.
So we've got old buildings, contaminated land, junk piles. Any other, less obvious places lead might pop up?
Yeah, there are a few others. Sometimes soil near very old, busy roads might still have contamination from leaded gasoline way back when.
Oh, still.
It can persist. Also, burning wood that was painted with lead paint, the ash, can contaminate the soil. And while it's less common, you can sometimes see issues from contaminated feed or water, maybe from old lead pipes or something.
Okay.
And just, random lead objects, fishing sinkers, maybe lead shot if it's an area where people hunted. If a horse finds it, they might ingest it. Vigilance is key.
It really sounds like it. So this lead gets into the horse's system somehow. You said it's like an imposter. How does it actually cause damage at, the cellular level?
Right. Think of lead as being really good at mimicry. Chemically, it looks a lot like essential minerals. The body needs things like calcium, zinc, and iron.
Okay.
So it kind of tricks the body. It slips into pathways and processes where calcium or zinc should be working. But instead of helping, lead just messes everything up. It causes widespread dysfunction.
So it pretends to be helpful, but is actually a saboteur.
That's a good way to put it.
Yeah.
And beyond that, lead directly interferes with vital cellular machinery. And this is where it gets really interesting, biologically speaking.
Yeah.
It specifically targets the process of making heme. Heme is that crucial part of hemoglobin in red blood cells that carries oxygen.
Right. Essential.
Absolutely essential. Lead basically throws a wrench into the works, inhibiting key enzymes needed to build heme.
Oh, wow.
So you get impaired red blood cell production, the cells don't function right, and that contributes significantly to anemia.
That's really alarming. It's like short-circuiting the horse's oxygen delivery system.
Yeah.
What else does it damage?
Well, it also messes with mitochondria. Those are the powerhouses of the cell, right? So it disrupts energy production,
Yeah.
and it directly damages neurons, the nerve cells. It interferes with neurotransmitters, the chemical messengers in the brain and nerves. This can actually lead to nerve degeneration over time.
Ooh.
Plus, it can directly irritate the lining of the gut and potentially damage kidney cells, too. It's pretty nasty stuff.
And once it's in the body, does it just float around? Or does it settle somewhere long-term?
That's another problem. Lead really likes to accumulate in bone.
In the bones.
Yeah. And once it's there, it has a very long half-life, meaning it stays there for a long, long time. The bones become this long-term reservoir.
Oh.
So even if the horse isn't being exposed anymore, lead can slowly leach back out of the bones into the bloodstream over months or even years. And this storage in the bone can also interfere with normal bone growth and remodeling, especially bad for young growing horses.
That long-term reservoir thing is really concerning. Does that mean some horses are just more vulnerable? Or does diet play a role?
Absolutely. Some are definitely at higher risk. Young animals, especially foals, absorb lead more readily than adults, and their developing nervous systems are way more sensitive to damage.
Makes sense.
And interestingly, yes, diet plays a big role. If a horse's diet is deficient in calcium or zinc or iron,
The very things lead mimics.
exactly, those deficiencies actually enhance lead absorption from the gut. So a poor diet makes them more vulnerable.
Wow.
Also, pregnant and lactating mares absorb more lead, and unfortunately, they can pass it across the placenta to the fetus or through milk to the foal.
Oh, that's terrible. Okay, so if it's such a silent threat and the signs are subtle, how do vets even begin to suspect lead poisoning? It sounds like a real diagnostic puzzle.
You nailed it. It is a puzzle. The diagnosis can be really difficult because the signs often creep up slowly, especially with that chronic low-level exposure we talked about.
Right.
So a high index of suspicion is just crucial. You have to think about it, especially if there's any potential history of exposure on the property.
So what are those key signs, the things an owner might actually see that should make them think, could this be lead?
Well, looking at the clinical signs, neurological issues tend to be the most prominent in horses.
Okay.
A really classic sign involves damage to a specific nerve, the recurrent laryngeal nerve. This causes paralysis of one side of the larynx, leading to what people call roaring.
Roaring. I've heard of that.
Yeah, technically it's laryngeal hemiplegia. It causes this harsh noise, especially when the horse breathes in during exercise, and they just can't perform like they used to exercise intolerance.
Okay, so a sudden onset of roaring or worsening roaring, that's a big red flag. What other nerve-related signs?
Another really significant one is pharyngeal paralysis, basically paralysis of the throat muscles used for swallowing.
Oh, that sounds bad.
It is. It causes dysphagia, difficulty swallowing.
Yeah.
You might notice the horse drooling a lot or quitting, where they chew feed but then drop it out of their mouth.
Quitting, right.
And the huge danger with dysphagia is aspiration pneumonia. Food or water goes down the wrong pipe into the lungs.
Oh, no.
Yeah, that's unfortunately a very common complication in lead-poisoned horses, and often it's terminal, so difficulty swallowing is critical to spot.
Absolutely critical. Okay, roaring, difficulty swallowing. What else neurologically?
You might see incoordination, ataxia, especially in the hind limbs, just generalized weakness, sometimes temporary or even permanent blindness.
Blindness, wow.
Yeah, and behavioral changes too. Maybe the horse is depressed, lethargic, just dull. Or sometimes the opposite, they can become hyperexcitable. Less commonly, you might see seizures or muscle tremors. And some horses might press their heads against things or grind their teeth. That's called bruxism.
That's quite a list of neurological possibilities. What about other systems? You mentioned GI and blood earlier.
Yes, gastrointestinal signs are also pretty common with chronic exposure. Weight loss is a big one, poor body condition, even if the horse seems to be eating okay initially. Later, you might see anorexia, which is reduced appetite, maybe intermittent mild colic signs, and sometimes diarrhea, sometimes constipation. It can be variable.
And the blood signs? Anemia.
Anemia is common, yeah, though it's often mild to moderate. There's a specific finding called basophilic stippling on red blood cells that's suggestive of lead, but honestly, it's pretty rare to see in horses compared to other species.
Okay, so you've got a horse showing some of these signs, maybe the roaring or the weight loss, and you know there's an old barn on the property. How do you actually confirm it's lead? What's the diagnostic process?
Well, the history and the environmental assessment are just fundamental.
Talking to the owner, looking around.
Exactly. You have to grill the owner, basically. Ask detailed questions about potential lead sources, how old are the buildings, any peeling paint they've seen the horse near, any old junk piles, batteries, nearby industrial activity, past or present.
Playing detective.
Pretty much. And then collecting samples from the environment is often really helpful. You might test suspect feed, water, soil from different areas, paint chips, maybe even vegetation the horse has been eating. Analyze those for lead content to pinpoint the source.
Right. Find the smoking gun. So once you have those environmental clues, what's the main test on the horse itself?
The primary diagnostic test, ante-mortem, meaning while the horse is alive, is measuring whole blood lead levels.
Testing the blood.
Yep. You collect a blood sample, ideally in a special tube that's certified lead-free. Now, interpreting the results is key. Generally, levels greater than 0.35 parts per million, that's 35 micrograms per deciliter, are considered diagnostic for lead toxicosis in horses showing signs.
Okay. 0.35 ppm. What if it's lower?
Well, levels between 0.10 and 0.35 might indicate exposure that needs looking into, especially if the horse is showing clinical signs.
Right.
But here's a really important caveat. Blood lead levels mostly reflect recent exposure.
Not necessarily the total amount stored in the body.
Exactly. Because lead gets stored in tissues, especially bone, the blood level might not perfectly match how sick the horse is, particularly with chronic long-term exposure. The lead could be hiding elsewhere.
So a normal or low blood level doesn't completely rule it out if the signs and history fit.
Correct. You have to consider the whole picture.
Are there other lab tests that can add pieces to the puzzle?
Yeah, other blood work, like a CBC, a complete blood count, might show that anemia we talked about.
Wow.
Sometimes you see changes in the red blood cells like nucleated reds, but again, stippling is rare.
Okay.
Your analysis can sometimes show increased levels of something called delta-aminolevulinic acid, or ALA. That can be a sensitive indicator because lead directly messes up its metabolism in the heme pathway.
Gotcha.
And if it gets to a post-mortem examination, the liver and kidney tissues are best for lead analysis. Levels over 10 parts per million in those tissues are usually considered consistent with poisoning.
And what about imaging? Can x-rays or scopes help?
They definitely can. Radiography or x-rays can sometimes show these thin, dense lines called lead lines in the growth plates of long bones, especially in young, growing horses with chronic exposure.
Really? You can see lead lines on an x-ray?
Sometimes, yeah. And if the horse recently swallowed something like paint chips or a battery fragment, you might actually see radiopaque metallic particles in their stomach or intestines on the x-ray.
Wow.
And endoscopy using a camera scope is really useful for looking directly at the larynx and pharynx to confirm that laryngeal or pharyngeal paralysis, the roaring or swallowing problems.
Okay, so let's say the diagnosis is confirmed. You know you're dealing with lead poisoning before you even reach for medication. What's the absolute #1 most critical first step?
Simple, but vital. Remove the horse from the source of the lead immediately.
Get them out of that environment.
Absolutely. Move them out of that pasture, block access to the peeling paint, get rid of the old batteries or junk pile. If you suspect the feed, stop feeding it immediately and get it tested. You have to stop the ongoing exposure before anything else.
Makes total sense. Stop the poison going in. Now, what about lead they might have just eaten? Can you do anything to get that out quickly?
Yes, if you suspect ingestion was very recent, like within a few hours, giving activated charcoal orally can help.
Like for other poisonings?
Exactly. It binds the lead in the gut and helps prevent it from being absorbed into the bloodstream. You can also use cathartics like Epsom salts or mineral oil to speed up the passage of material through the gut, hopefully pushing the lead out faster.
Okay.
And in really severe cases, say if x-rays show a big chunk of lead, like a battery fragment, stuck in the gut, surgical removal might actually be considered to stop it from continuously poisoning the horse. But that's obviously a major intervention.
Right, definitely a last resort. Okay, so source removed, maybe some gut decontamination done. The main treatment for getting lead out of the body tissues is chelation therapy. Correct. How does that work?
You got it. Chelation therapy is the cornerstone. It involves using specific drugs called chelating agents that bind very strongly to lead ions in the body.
They grab onto the lead.
Yeah, they form a stable, non-toxic complex with the lead. This complex can then be filtered out by the kidneys and excreted in the urine, effectively pulling the lead out of the horse's system, including from tissues like bone over time.
Okay, so which chelator is the main one used for horses? What do owners need to know about it?
The most common one, the go-to, is calcium disodium EDTA, usually just called Chieta.
Keita. How's it given?
It has to be given intravenously, usually slowly, typically twice a day, for about 5 to 7 days per course.
Okay. Any risks with that?
Yes, and this is really important. Careful monitoring is essential during Chieta therapy. You need to watch kidney function closely, keep the horse well hydrated with IV fluids, and monitor electrolytes.
Why is that?
Because candida itself can be nephrotoxic, potentially damaging to the kidneys, especially if the horse is dehydrated or if it's given too quickly.
Okay, so it needs careful vet supervision.
Absolutely. And depending on how high the lead levels were and how the horse responds, they might need multiple courses of treatment, often with breaks in between.
Are there other chelation drugs used? Or is Keita pretty much it for horses?
There are a couple of others. D-penicillamine and Sexamer, that's also called DMSA, are oral options, meaning they can be given by mouth.
Oh, that sounds easier.
It might seem easier, but honestly, their effectiveness and safety aren't as well established in horses compared to Keita. There's also an older injectable chelator called BAL, or British anti-leucite.
Okay.
But it's generally not used much anymore because it has some pretty significant potential side effects like tremors, convulsions, even coma. So Chieta really remains the primary choice in equine medicine.
Got it. Keita is the main player. Beyond actually pulling the lead out, what kind of supportive care is critical for these horses while they're recovering?
Oh, supportive care is hugely important. It can make or break the outcome. Fluid therapy, usually intravenous fluids, is crucial.
To help the kidneys and hydration.
Exactly. Keep them hydrated, help flush the kidneys, especially during chelation, and correct any electrolyte imbalances. Nutrition is also key.
Right, they're often losing weight.
Yeah. You need to provide really palatable, easy-to-digest feed to encourage them to eat. And in those cases with dysphagia, the difficulty swallowing. You have to be incredibly careful. Feeding wet mashes might help, but sometimes you might need temporary nasogastric tube feeding to get calories in and, crucially, prevent that aspiration pneumonia.
Tube feeding, wow. That's intensive.
It can be. Then there's pain management if they have colic signs or muscle soreness, anticonvulsants if seizures are happening.
Okay.
And if aspiration pneumonia does develop, you need aggressive antibiotic therapy immediately. Finally, making sure their diet has adequate calcium, zinc, and iron is important going forward, remember.
Right, because deficiencies make lead absorption worse.
Exactly.
So, with all this, the chelation, the intensive supportive care, what's the bottom line? What's the prognosis generally like for a horse with lead poisoning?
It's really highly variable. It can range all the way from good to, frankly, poor or grave.
Depends on the situation.
Totally. For a horse with mild signs, diagnosed early, with a relatively low lead burden and quick removal from the source, the prognosis can be pretty good with treatment.
Okay, that's hopeful.
But for horses with severe, long-standing chronic exposure, significant organ damage already done, or really intractable neurological signs, the prognosis is much more guarded to poor.
What are the specific factors that really swing that prognosis one way or the other?
Several things. The dose and duration of the lead exposure, obviously. How severe are the clinical signs when treatment starts? Profound dysphagia because of the pneumonia risk is a really bad sign.
Right.
Persistent blindness, severe ataxia or weakness that doesn't improve, the horse's response to the chelation therapy itself, the extent of kidney or liver damage. The age of the horse plays a role, too. And complications, especially aspiration pneumonia, are major negative factors.
And even if they survive the initial crisis, what about long-term? Can they go back to being, a performance horse or a comfortable pasture pal?
That's the tough part. Even with successful treatment, some horses unfortunately have persistent neurological deficits.
Like the roaring.
Exactly. The laryngeal hemiplegia, the roaring, might become permanent, or they might have some residual mild ataxia, like slight incoordination. These horses might not be able to return to their previous level of athletic use.
Yep.
And sadly, death can still occur, either from the overwhelming toxicity itself, those severe neurological complications, the aspiration pneumonia, or sometimes even complications related to the treatment, despite best efforts. It's a really, really challenging condition to manage.
It certainly sounds like it. Which brings us right back around to prevention being the absolute best strategy. Given how serious this is and how tough treatment can be, prevention is just paramount, isn't it?
Paramount, absolutely. If you can prevent exposure in the first place, you avoid this whole nightmare.
So what are the most practical, actionable steps horse owners can take to protect their animals?
Okay, number one, environmental surveys, especially if you're thinking about buying or leasing a new property for horses.
Be proactive.
Yes. Look around. Are there old buildings, especially pre-1978? Is there a history of industry nearby? Any signs of old dumping? If you have concerns, get things tested. Soil, water, maybe even some vegetation samples. Test for lead before you put horses there.
Smart. Test first. What about on a property you already own?
Then it's about identifying and removing or securing potential sources. That means dealing with any peeling or accessible lead-based paint.
On barns, fences, stalls.
Anywhere a horse can reach it. You might need professionals to safely remove or encapsulate it. Don't just scrape it off and let the chips fall where horses can get them.
Good point.
Also, get rid of any old lead-acid batteries. Store them securely away from horses, or better yet, dispose of them properly. Same goes for old machinery, scrap metal, any potential lead-containing junk. If you can't remove it, fence it off securely. Make absolutely sure horses cannot get access.
Containment is key. What about their feed and water?
Make sure you're sourcing feed from reputable manufacturers who have good quality control. For water, be aware of the source. Are there old lead pipes potentially involved in the water system? Is there runoff from a contaminated area getting into their water source? Test the water if you have any doubts.
Okay.
And fundamentally, education is vital. Owners, farm managers, everyone involved needs to know about the risks of lead poisoning and what the common sources look like. And one last thing, never feed hay or allow grazing on pasture you suspect might be contaminated. If there's doubt, test the forage or the soil first. Don't risk it.
Test, test, test. It seems like that's a recurring theme.
It really is the safest approach.
Well, this deep dive has definitely shone a light on the hidden dangers of lead. Those subtle signs, the importance of acting fast, knowing what to look for. It's clear that while it's a serious challenge, knowledge and prevention really are powerful tools for every horse owner.
Indeed they are. And, it really raises a broader question for all of us, doesn't it? Considering how persistent lead is in the environment, sometimes for decades or longer, what's our ongoing responsibility to regularly check our properties, to assess and mitigate these hidden dangers, not just for our horses, but really for the soil, the water, and all living things sharing that space with us?